you can hurt yourself in anything you do. You could hurt yourself in yoga, you could hurt yourself in sports, in any activity. You could even hurt yourself gardening, right? So if you are loading up joints and not properly aligned or aware of what you're doing, you can hurt yourself. And so when we are practicing yoga therapy for osteoporosis, there's an intention of creating strong stimulation to the muscles and bones, muscle building movement, muscle and bone building movement, in order to actually create the strength or the stimulation for strength. Hello. Today I'd like to discuss yoga therapy for osteoporosis. I'd like to discuss this topic because I think there is nothing better for bone health than yoga. There are many other movement practices out there that have tremendous benefits for strengthening your body, your bones, and your muscles. And yoga has so many all in one. And I'd like to explain exactly what yoga is, what yoga therapy is, why I find this to be the best way for us to take care of ourselves for healthy aging, and especially for keeping our bones strong and our balance strong and our posture and alignment and all the other factors, or many of the other factors that are important for bone health. So to begin with, the word yoga actually means union. It's a union of mind and body. And we are understanding more and more that we are not just a body and we are not just a mind, but rather there's this interconnectivity of our mind and body. And even in Western medicine, conventional medicine now, there's a lot more emphasis on things like breath work and meditation and understanding that the person with the illness or the disease is a mind-body complex. So there's definitely more raised awareness around this connection between mind and body. And that is what yoga is. It is connection of the mind and the body. Yoga therapy is a 1,000-hour training that's a clinical training to learn about clinical conditions. So when I did my studies, I went to Loyola Marymount University, and we were trained by physicians, psychiatrists, yoga therapists, physical therapists, chiropractors, and professionals that taught us or trained us about specific conditions, so that we take yoga and we actually customize the practice of yoga for the individuals we're working with. In my case, I specialize in bone health. So the population that I work with is women in menopause. Typically, most of the women most people I work with are women. Most are in menopause, and most, if not all, are diagnosed with osteoporosis or osteopenia. And all of us are focusing on healthy aging, staying strong as we age, wanting stronger balance. And then I raise this whole awareness piece for most of the women about how important posture and alignment is for healthy aging and for our bones. So yoga therapy is a specific, customized or tailored or targeted practice for healing, and usually for certain conditions. And if you do have osteoporosis or osteopenia, it is so important that you go to someone that is trained, that knows the body, that knows the bones. And I say this from experience. I myself received an injury from a yoga teacher that changed the course of my life and really put me on the path that I'm on today. And that's one aspect. The other thing is you can hurt yourself in anything you do. You could hurt yourself in yoga, you could hurt yourself in sports, in any activity. You could even hurt yourself gardening, right? So if you are loading up joints and not properly aligned or aware of what you're doing, you can hurt yourself. And so when we are practicing yoga therapy for osteoporosis, there's an intention of creating strong stimulation to the muscles and bones, muscle building movement, muscle and bone building movement, in order to actually create the strength or the stimulation for strength. And when you're doing that, you're pulling or pushing on your bones, on your muscles. And so it's really important that you be as safe as possible when you're doing that, which is why I think it's really important that if you are going to do yoga for stronger bones and for healthy aging, that you practice with someone that really knows what they're doing so that you could stay safe. And here is why I really find that yoga is the answer for bone health and healthy aging. Yoga, mind body practice, takes into account the present moment, takes into account the connection of the mind and body. So you set yourself up for practicing with whatever your intention is, right? Whether that's to calm your mind that day, to develop strength, to increase range of motion in your joints, flexibility, improve your posture, whatever your intention is, you come into the practice, you close your eyes or close your mouth when you're breathing, you focus and get your body ready with some movements, with some breath, and you stay in that moment when you are practicing. When it comes to bone health, here are some of the biggest things to focus on when it comes to bone health. We've got to create that stimulation to the bones. We have to push the bones into themselves, right? In the joints, pushing them towards each other, creating that compressive force or that tensile force of pulling on the bones when we're doing a stretch. We want to or need to make sure that our joints are in alignment when we do this. And when your joints are in alignment, you can create the appropriate strong forces necessary that will actually stimulate the most bone building stimulation possible in that moment. So with yoga and the postures that are chosen in the practice of yoga therapy for osteoporosis, I happen to use the work of Dr. Lauren Fishman. He is a physiatrist, which is an MD. He has 50 years of experience, worked with over 10,000 women. He has seen osteoporosis reverse, bone loss reverse. He knows it's possible. There's many other people that feel this way as well, but he's my biggest mentor, the person that I studied with when I first started studying osteoporosis in 2014, because I wanted to make sure that I kept every woman or every person that I taught yoga to as safe as possible and to create the maximum stimulation possible to get the maximum benefit from the practice possible. So Dr. Lauren Fishman has an ongoing study that has actually proven an increase in bone density. And in the 3 different practices, there are 34 postures that he has chosen. And these are postures that are in the practice of yoga. And he uses them for the specific intention of improving strength or flexibility or range of motion, either the muscles, the bones, posture alignment. So I use the work of Dr. Lauren Fishman in the work that I do because we have proof and we have the experience of Dr. Fishman, the experience of the ladies that have gone through his programs. I have my own experience in my own body. I have experience in the thousands of women that I've taught yoga therapy to osteoporosis for over the years. And I believe that it is the best way, the most valuable tool in your toolbox for the physical aspects of bone health. There's 2 things that build stronger bones. One of them are the nutrients. You've got to make sure that you are bringing in the nutrition. You have to make sure you're digesting and absorbing and assimilating it. And as a functional health coach, I run functional labs to help women heal their bodies and support the areas that are necessary in order to make sure that they maximize their digestion, absorption, and assimilation of the nutrients. The other main factor that is necessary for stronger bones is bone and muscle building stimulation. You have to demand more every single day from your bones in order for them to be strong for you. So when we practice yoga, we are present moment, finding this precise joint alignment, and then either bending or stretching or moving in a way that we are creating the safest, strongest stimulation possible to create more bone tissue, stronger bone tissue, better quality bone tissue. So we need 2 things, nutrition and we need stimulation. Yoga therapy offers that stimulation. Let's talk about what are the important aspects of bone health. One is strength. We want stronger bones. We also need better quality bones. We need bones that can withstand the pressures and stress applied to them if you do slip, trip, stumble, or fall. So we need to have strong, dense, and really good quality bones. So as you practice yoga, putting your body into these different postures, and then you create those forces necessary to create that strength in your bones. And if you do this often, and honestly, daily, if possible, at least 5 days a week, if you do something every day that you're going to create that stimulation, then you're going to develop that strength necessary. So, one is strength. We need strength in the bones. We need strength in the muscles, because the stronger your muscles are, the bigger and more dense and heavy your muscles are, they are sitting on your bones, right? That's what moves bones, or muscles. So they're actually sitting on your bones. So your bones have to be bigger and stronger in order to manage the muscles in a relaxed state. They also, because bigger, stronger muscles are going to have more forces when you pull on your bones, when we stretch or push them into each other, when you're doing a contraction or something like that. So the muscles, the strength in the muscles is important for strengthening your bones. And so when we do these postures, we are strengthening our muscles, holding them in the way that we hold them, being present moment to keep creating more stimulation, and appropriate stimulation, so that you develop the strength in your muscles, which is going to support the bones. So stronger muscles, stronger bones, definitely a major component of yoga or yoga therapy when it comes to bone health. Then we're going to come into flexibility. Flexibility, the ability for you to actually pull on your bones, to pull on them at the maximum range that you can, to safely pull on your bones, to have muscles that won't rip or tear because they're used to being manipulated by you through your practice every day. And as we move our body, as we stretch our muscles, there are studies that show that when we stretch our muscles, we're actually stretching our blood vessels and our nerves. And not even just stretching the blood vessels and the nerves in the area that we're focusing on. So when we're doing a hamstring stretch, there were studies that showed that there was even benefits in the nerves and the blood vessels of the upper arm on the opposite side of the body. We also know that when we stretch our tissues, we actually release fluids. So we create hydration in our body. And hydration is important because motion is lotion. And the more fluid and moist your body is, the safer you will keep it when you're actually stretching or moving your body. So flexibility, really important for bone health. One other aspect of flexibility is that the more you stretch your muscles, especially at the joints, let's take, for example, the ankle joint. If your ankle joint is limber and you're used to stretching it, you're used to pulling on the bones of the foot and the bones of the ankle, then if you slip, trip, stumble, or fall, whatever the stress that comes into that ankle joint, if it's used to feeling that, then it won't pull on the bones and create a stress fracture. However, if you have really rigid joints, rigid muscles, lack of flexibility in your body, then those tighter muscles, if you do slip, trip, stumble, or fall, are going to pull on the bones in a way that they're actually going to create stress fractures. So I call them dancing joints. And the more dance or play that exists in your joints, the wrist joint, the ankle joint are two main joints that I see this with, and also knees and hips and shoulders and the spine and the pelvic area. The more flexibility you have in your body, the better your body will receive anything that happens, slipping, tripping, falling. And bones don't break because they're fragile, they break because we fall. And it's the forces from the fall that create those fractures. So the more dance, the more flexibility and play that exists in your body, the better off you'll be. Another thing is range of motion in the joints. So having this ability to move the joints in the range of motion, full range of motion, the space between the joints. So not having bone next to bone, but rather having this cushion or space. It's going to minimize pain, minimize inflammation. As you move your joints, when we practice yoga, we actually move deposits of arthritis. So arthritic deposits that get first sticky in the joints and then eventually stuck in the joints. So I like to call them cobwebs. And you start to clear the cobwebs that exist in your joints So let's say you were starting to develop a little bit of arthritis in your body. And if you keep moving your body, you actually dislodge whatever those, they're called adhesions, the cobwebs that come and start to get sticky in your joints and then eventually can get stuck. But if you keep moving your body every day, then you don't allow them to accumulate and get stuck in the first place. So you keep that beautiful fluidity and that range of motion in your body. And that's going to minimize pain. That's going to also give you the ability to move more. And if you move more freely, you're more likely to do it. So keeping that range of motion is important. Another big factor of yoga therapy for osteoporosis or bone health is the awareness of the spine, the health of the spine, the alignment of the spine. Joint alignment is critical to bone health and critical to a pain-free body. When our joints are properly aligned, the forces of gravity that move up and down our body are actually appropriate to create this osteogenic load, which actually keeps the bones strong and good quality. And what will actually create even more bone building if it's a really strong force of gravity that's being applied. So we need to have these properly aligned joints in order to receive the forces that we apply when we do certain postures in yoga so that we actually build more bone tissue. The other important aspect of spinal alignment or joint alignment is posture. And spinal alignment is a very big aspect of posture. So in the practice of yoga, we pay a lot of attention to the spine. We move the spine in its 6 ranges of motion to keep it mobile, limber, strong, to move those arthritic deposits, to stretch what needs to be stretched, to strengthen what needs to be strengthened so that we can hold ourselves in this perfectly aligned position. So being in perfect alignment is going to keep the minerals in the bones in the first place. It's also going to minimize wear and tear in the joints from malalignment. And if we're off alignment, we have wear and tear in the joints. And that is arthritis. And that can lead to bone spurs or osteophyte development. So having that perfectly posturally aligned position is going to keep you out of pain and suffering. It's going to minimize wear and tear in the joints themselves, and it's going to minimize pain. Many people have low back pain, so that would be lower back. If you are posturally malaligned up higher, then you can get upper back and neck pain and shoulder issues. And so that is something that I see a lot, is a lot of shoulder issues. And this is from, in large part, a malaligned spine or having our head forward all the time, detoning or taking away the ability of the upper back muscles to do their job to hold the head on top of your body, and getting too tight in the upper front body muscles, the shoulder muscles and the chest muscles. So, and if you do that, then your shoulder joint is riding forward in the joint. It's going to impinge muscles and have an effect on some of the nerve activity that goes down to your hands. It's also going to have an effect on wear and tear in your shoulder joint. So a lot of people end up having torn rotator cuffs in their shoulder. These 4 tendons that are known as the rotator cuff in the shoulders, if the shoulder, the upper arm bone is forward, the gravitational pull on those tendons starts to tear over time. And that is from that forward head carriage, from that poor posture alignment, from the weakness of the back muscles and the tightness in the front of the body. So in the practice of yoga, there's a lot of postures that focus on the muscles of posture. Now, I keep saying the word posture for yoga, and maybe you've heard it termed as poses. And when yoga really became popular here in the West, when it came over to the West in, let's say, the 70s, we here in the West did a lot of things to yoga that are not traditional. And we call it poses, and we got so enamored with the physical body, and it became synonymous with a thin body, with tight clothes, really nothing like what it was practiced in India. In India, they don't wear tight little clothes. The women that practice yoga, I've been to India a few times, they cover their bottom, so they're not showing off their tushy or their lower body in the way that we do here. And we just did different things with yoga here. So this thought of yoga is that yoga is a physical practice, that it requires a lot of flexibility. It's what people say to me the most often when I say I'm a yoga therapist and I teach yoga. They say, "Oh, I'm not flexible enough for yoga." And I'll tell them, "Well, yoga doesn't require physical flexibility, it requires mental flexibility. You have to be willing to realize what the practice really is and why you do it." So the word poses indicates that you come into something and you hold that and you're in that and you're posing. When in actuality, it's a posture that we're looking for. We are constantly trying to find the joint alignment or find the flexion or the contraction or whatever the intention of the posture is. We are trying to find it. And while we're in it, we're trying to constantly stay in that place and work to refine it. So there's this balance in the practice, in the postures of effort and ease. We're trying to find the balance between the right effort, the effort necessary to create bone building and muscle building stimulation, yet not going too far, and finding the ease so that your mind is not too agitated or pushed too far in that posture. So it is a posture because we are working with bones and muscles and we're trying to align them, and in that alignment position, creating those strong forces. So the posture and alignment piece is huge in the practice of yoga because half of all the fractures are in the spine. And most people don't realize this. They're in the front of the spine. And the area that they exist is right below the heart to right around the belly button area. It's the 5 lower, well, it's T, 8, 9, 10, 11, 12, and lumbar 1 and 2. So it's these 7 bones where most of the vertebral fractures happen, and it happens from poor posture. And poor posture exists from having your head forward or for always looking forward. Everything we do, cooking, reading, watching TV, gardening, whatever it is we're doing, we're typically in a forward position. Our head is forward. And the weight of the 10-pound head puts a tremendous pressure, tightens the front muscles of the body, brings the shoulders forward in the joint, detones the upper back muscles, and puts pressure on the low back and tilts the pelvis forward. So in the practice of yoga, we focus a lot on posture and spine health and developing the muscles necessary because that's integral and very important part of bone health. So yoga therapy for bone health is going to strengthen your bones, your muscles. It's going to increase your flexibility, increase your range of motion, improve your posture, your alignment. And then we bring in this aspect of balance. Balance is so critical to bone health because bones don't break because they're fragile. We break because we fall. So fall prevention is huge when it comes to bone health. And that is from a mindset place or from a mental emotional layer. That's a place where a lot of ladies go when they have a diagnosis of osteoporosis. They worry about their balance. They worry about falling. And when you worry about balance and falling, you are more cautious or precarious. And when you're more cautious and precarious, you start to move less. When you move less, you create less stimulation for stronger bones and stronger muscles, flexibility, joint range of motion. So it's this whole process that diagnosis of osteoporosis brings into the layer of the mind this fear of falling, and women stop moving, and then it contributes to more bone loss. So if you practice yoga, we focus a lot on balance and improving balance, and balance in the joints, and balance on standing on one leg, and then balance in moving your body weight into different places so that the aspects of balance, one is proprioception, which is in the muscles and the bones through the nervous system in the body. Proprioception determines where is your body weight in space and activates muscle groups in order to keep you upright. The other aspects of balance is the visual and then the vestibular. So the ears and the eyes have an aspect of balance as well. And in the practice of yoga, we have the physical practice. We also have things that we do with our mouth, things that we listen to if we're doing any kind of sounding. With the eyes, we look for at a focal point. If you're doing balance, there's something called a drishti that we look for, which is the focal point to really hone in on this one specific area so that your eyes lock in on one specific area so you can work on balance in the physical body, work in balance with your eyes as well in the visual field. So there's a lot of attention placed on balance and improving balance in the physical practice of yoga and moving your body, like challenging yourself in postures so that you could develop stronger balance. There's certain postures that we do that you can actually self-assess that you're improving your balance. And then when that happens, you're going to improve your confidence. When you improve your confidence, you're going to move more, do more, create more bone building and muscle building stimulation. Now let's talk about the subtle aspects of yoga and how yoga can improve bone health in a more subtle, less seen way or less maybe known way. We match breath with movement in the practice of yoga. If you are not matching your breath with your movement, you're not practicing yoga. So there's a attention placed on breath and how you breathe. Most often, we keep our mouth closed in the practice. We direct the breath in through two nostrils versus one big opening of the mouth. That gives the body the opportunity to warm up the breath before it comes in, to cleanse the breath because we have little hairs that will trap some of the particles that exist in the air for the immune system. So we keep the mouth closed. We focus on the breath. We are very body aware, present moment, so you can really feel and notice what you're doing so that whatever you're doing is appropriate, and developing that deep interoception, that inner body awareness, so you could stay safe. And when you are in that place, you could create the maximum stimulation for you to build a stronger body, a stronger mind, stronger bones, stronger muscles. So breath is really important for staying present moment. Breath is the connector between the body and the mind. When you start to focus on your breath, you are now connecting your body to your mind. You're actually managing stress, moving yourself away from that limbic loop of chronic stress that's in the subconscious brain and bringing yourself to the prefrontal cortical brain of consciousness. You come to present moment. So you're actually moving in your brain when you're focusing on breath. That's going to be great for stress management. When we use our breath, that is actually the respiratory system. And it's the only body system we have immediate control over is the respiratory system. When we can control our respiratory system with breath, whether we're focusing on equal inhale and exhale or extending the exhalation or adding a retention at the top and the bottom, or using the control in pranayama, the areas that we have control over the breath are either at the diaphragm, the throat, or the nostrils. And the different breathing techniques that we use are either going to be controlling nostrils, throat, or diaphragm. When we do this and we're controlling respiration, we now are going to be having an effect on the nervous system, the cardiovascular system. You're having an effect on your biochemistry, your physiology. That is where bone building and bone dissolving takes place. Bone loss, bone building is a biochemical action. So when you focus on your breath, as we do in the practice of yoga, we are actually affecting the biochemistry of bone remodeling. Not very many other practices are doing all of that at once. Posture, balance, alignment, strength, affecting your physiology, calming your mind, connecting your body and your mind, increasing range of motion in the joints, flexibility in the joints, fall prevention, fracture prevention. The breath is a critical aspect of this practice. And when you start then to actually bring in the breath part, now you can go into the calming of the mind part. So now we're going to bring up the word mindfulness, which mindfulness means right here, right now, present moment. And then the deeper, real healing aspect of the practice of yoga is meditation and freeing yourself from suffering as a human being. That's what the true goal of yoga is: freedom or liberation from suffering. So, liberation from suffering in the way that we do with our mind, worrying about the things we worry about. The more you practice the physical practice of yoga, the stronger your body feels, the better your balance is, the better your posture is, That's going to help you feel more confident in your body, not feel like you're going to just fracture a bone from moving or sneezing or walking. And then you're going to do more. You're going to participate in your life more. So the mindset piece of osteoporosis, the minute you get the diagnosis, the feeling of being breakable and fragile can have a negative effect in how you show up in your life every day. Practicing yoga is going to strengthen your physical body, get you to use your breath, start to go into controlling your mind, start to develop confidence, and actually really get to that layer that was triggered the minute you got the diagnosis. The minute you get the diagnosis, it's at the layer of the mind that is the biggest shift. Yoga is for the mind. Yes, we use the body. That's the way we get to the mind, is to use the body and to use the breath and to get to the mind. So every day showing up for yourself, working on strengthening your muscles, your bones, your posture, your alignment, your flexibility, your range of motion is what's going to give you the confidence to have that strength of mind, to know what is possible, what you can do. And that is how you take care of yourself with yoga therapy for osteoporosis. That is where the value is in this practice. And there are even more places where I'm sure there is value in this practice. I see yoga therapy for osteoporosis as the answer to bone health, to happiness in your mind, to confidence, to you taking charge of your body and bones as you age, to aging healthy, aging as strong as possible, and maximizing this one beautiful, precious life that you have to live, doing all that you can with this one life that you have. I say this, you may have heard me say this before if you've listened to any of my other podcasts or follow me on social media. Choose the number 100. How many more years do you have until that number? Because that's how many more years you have to live a very full, active life. And if you want to live a full, active life, then every single day you need to show up for your body, for your bones, for your mind to have that. Yoga therapy can give you that. It can give you the stress management piece, the mind piece, the regulation of breath, cardiovascular health, of nervous system health, and even deeper than that. So we're going, and then having that effect on your biochemistry, your physiology, where bone remodeling takes place. One more thing about breath, because I said that there's probably more, and here I just remembered another one. The two main ways that our body manages toxicity is through the kidneys and through the lungs. The kidneys the bones will dissolve alkalizing minerals to help manage metabolic acidosis in the body. The other way is through exhalations. So when you do breath work, pranayama, when you extend your exhale, when you deepen your breath, when you focus on your breath, you're actually having an effect on your biochemistry. You're having an effect on toxicity. Toxicity is one of the root causes of bone loss. So there's another factor of how can yoga therapy support bone health. Breath, meditation, present moment, mindfulness, a deeper body awareness, a physical ability to create bone building, muscle building stimulation. All of that exists in this practice. And then you develop that confidence to show up for yourself every day so you can live the best, most active, most fulfilled life possible for yourself. I teach live classes every week. I've got a YouTube channel, Debi Robinson Wellness, that has hundreds of recorded videos. I have master classes and membership programs and so many ways for you to learn. How can you learn safe yoga? How can you learn yoga therapy for osteoporosis? Because to me, there is nothing else for our bone health like the practice of yoga. Thank you so much for listening to Stronger Bones Lifestyle Podcast. Bone loss is not an inevitable part of aging. We don't have to just wait for it to happen. There is so much that you can do, and that is what you will learn each week on the show. Go to my website, debirobinson.com, if you want more information about what was shared in today's episode. At the bottom of this episode in the show notes, there will be links to whatever was shared. Please subscribe to this podcast, share this podcast with your friends, your family, or any women that you think may be interested or benefit from the information we're sharing. Please rate the podcast. And if you have any questions you'd like asked or answered, I would love to hear from you. Let's do this, ladies. Let's change the way the world views osteoporosis and slow down, stop, or reverse our bone loss, take charge, and show other ladies what is possible. Thank you so much for joining me.